This is the Birth, Baby, and Life podcast, and we're asking if pregnancy is actually dangerous in episode number 212. Hi ladies, it is Kristen, and today we are going to be looking at the dangers of pregnancy and how they may impact you from a realistic perspective. Now, if you don't know me, my name is Kristen. I am a pregnancy coach, and I work with mamas all over the world, helping them to really enjoy pregnancy, grow a super healthy baby, and have a beautiful birth. I also work with mamas who are trying to calm the chaos and want to have a little bit more peace and fun at home with their healthy, happy children. Now, like I said, this episode is going to cover kind of what I feel like is a hot topic, even a weaponized topic today. I also want to say at the beginning of the episode that my kids are out front just getting their day started as I'm recording, and they are really noisy. So if you can hear them in the background, I apologize for that because I have already asked them to be quiet, and well, I think they just forget how noisy that they get. Anyways, so I just wanted to start this off. We're going to do a 2-episode series here where we're revisiting some of the topics that I already tackled in the abortion episode, but I want to look at them from a slightly different perspective. I've gotten some feedback from listeners, and I wanted to address that feedback, though that will primarily be in the next episode when we're going to talk about things that you've been told about abortion and how they are wrong. So I hope that you will listen to that episode. These episodes are really meant to go together. But in this one, I want to talk about pregnancy because I feel like many of the comments that you're seeing on social media, and I don't have the savvy to do like all the little response videos and things that you see other YouTubers and those sorts of people do where they play a video and they respond to it. But I have seen a lot of videos where women are saying that they don't want to get pregnant now, and they seem to literally believe that their lives will be in danger if they're pregnant. And I felt like it was important to address that from a factual and evidence-based perspective at least. And then there are some other issues with abortion that I felt like are important to talk about, and we'll talk about those in the next episode. So I wanted to start off with a quote, and this quote comes from the Mom Jeans book by Abigail Tucker, and she's actually quoting a cardiologist whose name is Hina Chaudhry in the book. So this is Hina's quote, and she says, "The fetus is designed to protect the mother." So I thought that was an appropriate quote to start off a podcast episode where we're going to talk about the safety or lack thereof in pregnancy and look at the fact that the baby is actually designed to protect the mother. And we're going to talk about this in a lot more depth in the next podcast episode, but it's just something to keep in mind right now. And this kind of goes to the same thing. If you've listened to my birth episodes, you've heard me say this. I'll say it really doesn't matter what your worldview is, whether you believe in evolution, whether you believe in intelligent design. Birth is designed to work. And this is similar. Whether you believe in evolution or whether you believe in intelligent design, pregnancy is designed to work. It is designed to be a safe process for mother and baby. And if you look at work such as, for example, Dr. Sarah Buckley's extensive research, which she has just built upon over the years, even up to her PhD level research, it's not just meant to work. It's meant to be a good, positive, even ecstatic experience. So how do we go from that's really the biological, evolutionary, creationist reality of pregnancy and birth to women posting TikToks every day about, because of politics, they won't get pregnant because they're sure that they're going to die. So where do we get to this place, and what do we do to talk about it? So that's what I want to address in these next couple of episodes. So the question is pregnancy actually risky to women? And I want to start that off with an all life is risky. So I've been having a conversation with somebody recently and kind of talking about this person is older and, what happens if something happens to them? And statistically, it's more likely for an older person to have something happen than a young person. But I pointed out none of us are guaranteed anything, right? Life is risky. Getting in the car, going for a drive. I could drive to the grocery store, which is 5 minutes away from me, or to the little public library, which is 5 minutes away from me, and I could be in a car accident and be gone. All life has inherent risk. Just living and being alive has inherent risk. And that's something to keep in mind when we consider that pregnancy and birth, sure, they're risky, but so is, going in your car to visit your family for the holidays this season. So all life has some inherent risk. And I'm not saying that to be flippant, but just to put that into perspective that yes, This is risky, but there are many other things that we do every day and make choices to do every day that also have risk, and we're not swearing off of those things because of the risk, or even have higher levels of risk, and we're not swearing off of those things because of the risk. So I've got a lot of notes, so you'll see me look down to refer to the notes. So I also do want to acknowledge the reality that we are living in a place and a time where maternal mortality rates are rising. So we cannot have this discussion without having a fair discussion of that. And one of the biggest things, and I'll come back to this again and again, but one of the biggest problems that I see with this entire narrative about the concept of pregnancy being dangerous, or the concept of we need to sink billions into abortion, is that perhaps some of those conversations and discussions that should be being had about maternal health and safety are going into many other issues. And I talked about this before. For example, going into abortion, or going into, fighting about women's rights and what even defines a woman, which is, really I made this clear in a previous podcast episode, but I think it's a ridiculous conversation to be having. And it greatly, greatly, greatly distracts from real conversations that we need to be having. But so the maternal mortality rates are rising, and I think we aren't having those conversations because we're so busy having other conversations, or the maternal mortality rate rise is being weaponized to become a conversation about abortion. But that is not what the conversation should be. You could argue perhaps that it's part of it if you feel like that's an important thing. But maternal mortality rates are fixing that. You don't fix that by aborting every baby, right? You need to fix that in other ways. What if women desire to have their children? You can't say that the answer to maternal mortality rates is just to never have children. Number one, you make many women very unhappy. Number two, you destroy your species in a generation with that take. It's just a distraction. It's almost a red herring, right? So another thing to look at, though, with maternal mortality rates is we're not just seeing maternal mortality rates rising. We're actually seeing health decrease and mortality rates seeming to rise overall from things, for example, metabolic health issues, heart attack, diabetes, all of that stuff is related to metabolic health. They said it many, many years. I can't remember who said it. Maybe it was Hippocrates. I should look that up. But anyways, he said, all health begins in the gut. That was said way back in the day, right? And it really seems to be true. It seems to be our choices with nutrition and convenience foods and processed foods and rancid oils and way, way, way more carbohydrates than human beings were designed to eat. All of those sorts of things are the root of so many disease processes. And those things are, I believe, a huge part of the root of why we're seeing an uptick in maternal mortality. So, I try to keep this really family friendly, but when I was thinking about the show notes, I was thinking, the problem is that we're eating sugar and shit, right? That's the bottom line, is our moms have plenty of food, but it's devoid of many nutrients, and it's actually actively causing things like women who are in their 30s who are pregnant today are not as healthy as women a few generations ago. Now, one of the reasons why we saw a decrease in maternal mortality was related to better nutrition, better hygiene, more sanitation. So we saw an increase in good outcomes, and now we're kind of seeing a backtrack because now we're facing a lot of other things. We've got, sugar, carbohydrates, rancid seed and vegetable oils, inflammation in people's bodies. We have young women who are coming in showing signs of insulin resistance, and all those kinds of things are problematic. We have depleted soils. We live in this world where we're super isolated, really, from community. Everybody lives in this kind of disembodied virtual world. And our coming together as a community has been seriously limited. We had the pandemic happen a few years ago, and all of these things are playing into stress and just unnatural burdens, lifestyle stressors, diet for human beings. It's just this disembodied, unhealthy existence overall. And the medical establishment pushed for years the lipid hypothesis and that fat is bad, and that completely destroyed health. Red meat is bad. All of those things completely destroyed the health of generations who were raised on skim milk and carbohydrate. So there's no nutrient density there, and women don't have a taste for good food, or they're scared of good food. And these things really cause a problem. And then we also face a complete and willful lack of consideration for the difference between early detection and prevention. And this, I may do an entire podcast episode on this, but early detection means monitoring, basically waiting with bated breath for something to go wrong. That's the obstetric model. In fact, that's basically the medical model. We're just going to wait until something goes wrong, and then we've got life-saving things to hopefully swoop in and fix it. But we're just going to wait till it goes wrong, and then we've got drugs and procedures and all this to handle it. It's all intervention based. And again, this isn't limited to maternity care. You know, my sweetie had recently had some men's health issues, and it was kind of the same thing. It was like, oh, we're going to swoop in and suggest all this stuff now that there's a problem, but there was no talk or discussion earlier in his life about prevention. But I really think that it's abhorrent in maternity care, because ethically, it's just abhorrent. In some ways, I really think that it's going to continue to get worse, like I said a minute ago, because we got an opportunity cost here, because the discussion has veered away from how do we make pregnancy safer into pregnancy is inherently dangerous, so let's just end it all, right? So that when young women are hoodwinked into believing that this is dangerous and that there's nothing that they can do and they're just going to face these grave complications, then the discussion ends. And does the research perhaps end? So we have big problems here, but what we need to be focused on is prevention. I do believe that we want to be focused on early detection. As a student midwife, I know all the signs of preeclampsia, peripartum cardiomyopathy, all of these issues that we want to watch for. But I also, right now I'm not working as a midwife, I'm working as a pregnancy coach. So I'm working, in conjunction with a woman's care provider. But, when I'm talking with women, I'm counseling them on all of these things. These are things that you can do to prevent these complications from ever happening. That is a different discussion than early detection. Early detection should be in place, but it should not stand alone. Prevention should be in that conversation as well. So then the question is, are there dangerous health complications that can occur with pregnancy and birth? Yes, you heard me mention a couple of them: preeclampsia, peripartum cardiomyopathy. But I want you to listen to the next episode, because it definitely is interesting that fetal tissues can actually seem to repair damage in mothers' bodies, and peripartum cardiomyopathy is one of the complications where we've seen that happen. Postpartum hemorrhage can be life-threatening to a mother, and also hemorrhage associated with a miscarriage can be life-threatening to a mother. Another thing when we're looking from a mental health perspective is postpartum psychosis. So those are just things. And then there are also conditions that can make pregnancy more dangerous. They may not be on the level of the others, or they're things that are that can severely limit quality of life, like hyperemesis gravidarum. And then there's also comorbidities that may arise during pregnancy, like women who receive a cancer diagnosis during pregnancy, or have a pre-existing condition and they fall pregnant. So all of those are issues that we need to look at. But what all of these conditions argue for is for more research into the etiology of these conditions. How do they happen? Why do they happen? How can we prevent them? And really looking too at the whole scope of the research, like if research in all of these fields is, for example, pointing to the fact that metabolic syndrome or insulin resistance seems to be at the root of much disease, and that it's happening at younger and younger ages, or that chronic stress and just kind of this toxic, disconnected, disembodied culture that we live in is at the root of mental malaise, what can that research help inform us when we're looking at pregnancy and birth? If we look at the fact that people who are on low-fat diets are starved for they're starved for good, healthy fats that help their brains. If we look at that research, what can we extrapolate, or at least hypothesize, to pregnancy? What research can we set up? It can be difficult to do pregnancy research because there are ethical considerations. For example, if you think that this is going to prevent a disease or a complication of pregnancy, is it really ethical to do a double-blind controlled study? It's probably not. So you have to look at those sorts of things, because you would not want to withhold something that could be life-saving from any mom. And then also, you need to look at things like the flawed vitamin A information that went around. Like, we know that lack of vitamin A causes severe birth defects. Yet women today are afraid of vitamin A because they've been told that vitamin A will cause birth defects. But the reality is that when we are looking at supplemented, added synthetic vitamin A, that seems to be what the problem is. Not, for example, natural vitamin A that you might find if you had liver once a week. So we need to look at all of the ethical questions and also all of the confounding variables and talk about how can we ethically construct research studies? How can we ethically observe populations? And how can we overcome our own biases, like the Mediterranean diet is the best diet. Everybody needs lots of carbs. Fats are bad. How can we overcome biases from hypotheses that have been found to be incorrect? And how can we apply those things to maternity care? Like, this is literally my passion. This is what I've been studying, researching, and teaching now for going on 20 years. It's crazy to believe that. I've been studying it for longer than 20 years. I started thinking about teaching it 20 years ago. And I started my website as this podcast is getting ready to go live. It's going to be on basically the 19-year anniversary of my website going live. So I have been doing this for a very long time. This is literally my heart and soul outside of taking care of my own kids. And the question is, can we prevent everything? No, we can't prevent everything. I believe we do need life-saving interventions. I believe we do need the skills of obstetric providers who can come in and perform life-saving procedures or bring life-saving medications or whatever, interventions, when they are needed. And that's one of the reasons why maternity care deserts are a problem. And that, I don't have a lot of time to go into that, but I do feel like when we have areas where women are given literally no education on pregnancy and birth, or the education that they're given is from public health materials that are based on decades-old research and that are also now erasing women, and so they're just kind of unsavory overall. But, and so that's all they're getting is public health information. They're not getting good monitoring, or they have to drive forever. Those maternity care deserts are a big problem. I don't think that's a problem that's going away. Again, it's also not limited to maternity care, because you see healthcare deserts overall in these areas. And so that, and I'm speaking specifically about the United States here, but that is, this is a policy reform, like looking at things from public policy, social policies, all of those kinds of things. But again, if all of our time and energy is being spent on saying pregnancy is dangerous, women need abortions, how much time are we really focusing? Or if we're saying, such and such a state passed stricter abortion laws and now they have maternity care deserts. And it's like, correlation does not always equal causation. And sometimes maybe the conversation needs to be, let's actually analyze maternity care and healthcare deserts. Figure out why it's happening and what can we do to bring maternity care providers into the area, to incentivize them. One problem in the United States is that the only legit maternity care providers are obstetricians and certified nurse midwives who are on a leash with an obstetrician. And so if we were to look at midwives who provide most maternity care throughout the world, then maybe having more midwives and helping figure out how they can have a sustainable career would be a thing. Because another problem, and this is a problem with everything, is who doesn't want to get paid? And especially, for example, a midwife who's on call, maybe doing 3, 4, 5 births a month. She's on call, plus she's doing prenatal visits. She's going to go out in the middle of the night, even if it's a blizzard, even if it's their kid's birthday, even if it's Christmas. And then women are going to complain about how much she gets paid. Yet, the guy down the street who's running, some male-oriented business is getting paid a lot. So looking at the fact that we seem to villainize women who want to be paid what they're worth is a problem. Or assuming that women's work is not as high value. Like what the midwife does is not as high value as a Fortune 500 company. And it may be true on a level that her services are very one-to-one, and so they can't meet for perhaps what scope a corporation could meet. And so maybe her compensation shouldn't be on that level. But surely her compensation should be enough to provide her with a comfortable living. And I think that's the case too, even with OBs, to be honest, is medical insurance companies don't want to reimburse. If you've got state-funded healthcare, it doesn't reimburse well, and so you have fewer providers. And it'll be interesting to see, for example, Michigan has just raised the amount that doulas can be reimbursed by the state, and it'll be interesting to see if that brings in an uptick of doulas. And so that you can see that there are so many complex factors going into why is maternal health declining? Why is maternity care not available? Why are we not educating women on prevention rather than just early detection? There are so many facets to these conversations that are just, there's just a gross oversimplification. And the bottom line is that pregnancy, even for a suboptimally nourished woman in a first world country, is usually going to go okay. Even with everything else that I just talked about, the complications that I just mentioned, most women are going to have a healthy pregnancy and birth. And we also don't know the answer to the question when women go to the hospital and they have a problem that is an emergency, how much of that emergency was iatrogenic, which means caused by the doctor, futzing with the normal hormonal flow of labor. For example, postpartum hemorrhage, Michel Odent argues pretty compellingly, he's a French obstetrician, that postpartum hemorrhage is often an iatrogenic, life-threatening complication. It's caused by messing with the natural process of pregnancy and birth, which is designed or evolved, whatever you believe, to be a safe process with hormonal triggers. Again, Sarah Buckley's work is great to read if you want to truly understand the hormonal flow of labor. And of course, in Mama Baby Birthing, I talk about that. Or if you're wanting to chat one-on-one about your pregnancy and birth, reach out to me because I do have slots open for coaching right now. But again, we do need to be aware of the complexities of these problems. We do need to be aware of problems like maternity care. And I do believe, again, that monitoring is important. Education and monitoring together are important. I really believe that every woman deserves a midwife or a doctor or a pregnancy guide behind her, even if she's choosing a wild pregnancy, because I don't think that women should feel like they have no options or they have to opt out because they don't feel respected or heard in their care or they feel belittled. That's one of the reasons why you hear a lot of women choosing wild pregnancy. Now, I've got a woman who I work with, as a business coach, and I think she probably would, when she was having her kids, if wild pregnancy had been a thing, she would have just chosen that because she's just kind of an independent gal. But I think most women want a guide in pregnancy and deserve a guide and deserve somebody who's knowledgeable. There is so much. Like I said, I've been doing this for 20 years. There is so much to absorb and learn and marinate in the research. And you shouldn't have to go through all that. Because, when we think about it, women in the past had guides. They had wise women in their tribes, in their villages that were there for them. And those women didn't necessarily understand all of the physiology and the biochemical stuff that we understand now. But we know, from example, Dr. Price's work, where he went to many different cultures and noted that women who were newly married or who were pregnant were fed special diets in many of these cultures. There was a wisdom that humanity had, that this was a special time, it deserved to be honored, and it needed special treatment and even extra nutritional support, extra stress relieving support. Postpartum nurturing was an important part of many cultural traditions. All of these are things that have just been lost now, and we're fighting to have to bring back. So anyways, every woman deserves that guide, that auntie or that granny or that wise woman to guide her, whether that be a doctor or a midwife or a pregnancy coach or whatever. Every woman deserves that, and not every woman has that. But again, I feel like what we need to go back to is that pregnancy is not actually inherently dangerous. It's meant to go well. It's meant even to be an ecstatic and wonderful experience. And that choosing to seek medical treatment for a complication does not necessarily equal abortion. And we're going to talk more about semantics and all of that kind of thing in the next episode. But I wanted to keep this one shorter and more succinct. I want to reiterate what we know about healthy pregnancy and how do we have a healthy pregnancy. So this is it's a time to honor this time. Honor that pregnancy is, so many women today are on a career track, and I'm not saying that's a bad thing, but I do think that when you're pregnant, give yourself permission to step down the intensity a little bit. I think a lot of women actually, and I'm guilty of this across some of my 8 pregnancies, some women see it as a time to increase the intensity because you want to get it all done before the baby comes, whatever it is. But I would encourage you to actually step back the intensity. Step back the intensity and let this be a time when you can treasure this time, when you can enjoy this time, when you can really pamper yourself and your baby and connect with your baby and connect with nature and normal healthy rhythms. I mean, I talked a lot about nutrition so far, but we haven't talked about quantum biology, circadian rhythms, being in the light and dark, being outdoors, living a natural seasonal life that human beings have lived for generations. All of these things are so important, and honoring that pregnancy is a season of time that is meant to be slower because you are already doing an awesome project. You are growing a brand new human being from scratch. And that is an awesome, awesome thing. So honor this time. And I know you may be busy at work. You may be a busy mother chasing other children. Maybe you're helping your husband with a lot. But maybe you're a caregiver for an older family member. But as much as you can, take space, make space, because I don't have time. It actually means I haven't prioritized anything, or I haven't prioritized this. And I say this with the utmost love and empathy because I'm terrible about this. Like, I do not take time for myself because I don't hold taking care of myself at a high enough priority as compared to the other gazillion and a half things that I'm doing every day. But I would encourage you that at least in pregnancy, don't say I don't have time. Instead, realize I'm not making this a priority and ask yourself, how can I make it a priority to have some time to slow down, to breathe, to relax, to honor this time, to connect with myself, my baby, whatever spiritual stuff you've got going on every day, and really honor the time. And that will really help bring about a safer, more enjoyable pregnancy experience. Next, as you can guess, nutrition, nutrition, nutrition. Please watch what you eat. Please understand what is physiologically needed for pregnancy and birth. Do not go pick up public health booklets on what you need for a healthy pregnancy. Reach out to me and we can talk about customizing a healthy pregnancy diet for yourself. Just go to birthbabylife.com/beautiful and book a call with me. Or at the very least, pick up Lily Nichols' book, Real Food for Pregnancy, which is extensively referenced and is the most up-to-date volume on what actually makes a healthy pregnancy diet today. If you have not, had the wool pulled from your eyes about healthy nutrition overall, this book will be paradigm shifting for you. So at least do that for yourself. And if you're expecting multiples, get Dr. Barbara Luke's book, When You're Expecting Twins, Triplets, and Quads, and read that in conjunction with Lily's book. Or again, if you're like, Kristen, this is overwhelming, I need somebody to hold my hand, walk beside me, and help me fix this food, then definitely reach out to me, because that's one of my favorite things to do with clients, is helping figure out, okay, well, I read all this, but I need to figure out what it looks like in my actual life. So I will help you do that. But please, eat nourishing food. Follow a healthy pregnancy diet. Eat real food. Dump the processed food in the junk and a good measure of the carbs, and eat real foods. Eat healthy meats, grass-fed if possible, but start where you can go with your budget. Eat lots of veggies. Fill your plate with veggies first. Focus on getting plenty of protein, and then make sure that you're also getting in healthy fat. Enough fat is critical. I mentioned, for example, postpartum psychosis, and some of that might be that a woman who is prone to that already has some mental health conditions going on. But I believe that for every human being, those with physical ailments or mental ailments, or who are hoping to prevent all of those ailments, Eating a healthy diet is critical, and we know that healthy fats nourish the brain. And could one of the reasons that we are seeing so much mental health problems in younger generations be, again, that they were raised like I was in the 80s when we're at the height of the low-fat craze, and so, we're skim milk, chicken breast kids, and that's it. Like, there wasn't healthy fat for nourishing growing brains. Even the conventional medical establishment today is starting to relent. They started by saying that we need to give kids whole milk until 2 and then we'll stop. And I think, again, they've kind of missed the boat, but at least there is a beginning understanding that we should not be starving children's brains of fats, and you should not starve your brain of fat in pregnancy. Your baby's brain knows that it needs fat and will hoard essential fatty acids up to 10 times the amount that he or she actually needs, which means that you're not getting those, which means you need to be eating a lot of food. Grass-fed meats have lots of omega-3s. Fish has lots of omega-3s. Get those healthy things in. And cut out the rancid seed oils and the rancid vegetable oils that mess up the omega-6 to omega-3 fatty acid ratio so that you're really getting the good omega-3s. Stick to something like coconut oil, olive oil, avocado oil for your cooking, and eat those healthy meats. I'm not saying that you have to sit down with fatty cuts of meat for every meal, but slow cooked meats, grass-fed meats, lots of fish, all of those things are going to be good for you. They're going to give you lots of protein, lots of healthy fats. And then the veggies are going to give you good fiber. Make sure that you're emphasizing green leafy veggies. I know that can be hard in the first trimester. A lot of women have an aversion to green leafies in the first trimester. But see if you can build them back up as you go along. And again, if you want help with thinking through any of this, planning any of this out, reach out to me, birthbabylife.com/beautiful. I already touched on this a little bit, but also focus on stress relief. Stress is toxic in our culture. If we look at hunter-gatherers and other traditional cultures, they just took a lot more time off. And I think, even when I look at my life and think that I'm so very busy, and I was thinking about it the other day because I was feeling frustrated about the business and not making as much as the kids and I need, and what do I want, and trying to make decisions here and there on what I'm going to do as I'm approaching the end of the year and going forward into next year. And the thing that I realized when I was thinking about what do I want is I really want time to relax, to disconnect from work and all of that kind of stuff, and just connect with my kids and be with my sweetie and all of that kind of stuff. In the evenings, just relax and feel like I have permission to relax. And that stress is not unique to me. Like that stress, that feeling of go, 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 that I've got to push, 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 this, that, and the other. And there's so many things that we can do. In fact, I've even been really pleased lately. I've found a way that I can do food preparation in a way that feels super sustainable and easy for me once a week, and it makes food preparation throughout the rest of the week to be much simpler. And I can talk about that on another podcast episode. If anybody's interested, just shoot me an email. But looking for little time savers like that. And again, I'm 20 years into being a homemaker, so I've experimented here and there and done all kinds of different things, and different things have worked in different seasons. But I think spending some time really asking yourself, what can you do to reduce stress? What can you do to calm down? How can you make these pockets of time, like we talked about a few minutes ago with honoring your pregnancy? What can you do to relieve stress? That's important. And I touched on it a minute ago too, but quantum biology, which is just looking at your health from the lowest possible, the smallest possible level, like on a molecular level, on a cellular level, what really nourishes our cells. And some of what we know, quantum biology is a field that's just emerging. But some of what we know is that those traditional ways of living, where we were up and working when it was sunny and we went to sleep when it was dark, that those sorts of quantum alignments are important, and they have an impact on our health. For example, your gut microbiome is messed up if you are up all night and sleep during the day. It impacts your gut microbiome. So we know there's lots of things, like eating tons of carbs changes your gut microbiota. Interrupted sleep changes your microbiota. But we're just starting to understand the microbiome. We're just starting to peek at quantum biology and how that impacts your health. But there are things that we know can help. For example, eating a nourishing diet, going to sleep at night, Getting up and getting going in the day, getting active first thing in the morning can be really helpful. Going out and spending time in nature. You see me pointing to the window. Going and spending time in nature and being around sources of running water is really good. But even just walking, nature bathing, I think that's a Japanese term, is really good for you. Those sorts of things are equalizing on your body and on your health. And when I've got a mom that I'm working with right now who is starting to show early warning signs of some of these things, I not only go over nutritional interventions with her now, and in fact, sometimes I will advise like a 3-day intensive nutritional intervention if a mom's really showing signs. And I've started also incorporating Nico Kennedy's 3-day quantum reset. And I'll link to Nico's website. She's doing a lot of work in quantum biology in the pregnancy, birth, fertility space. And she's got a reset, a 72-hour reset. And I've started recommending that moms do those two things together, because I just feel like it's such a powerful way to reset the system and to get things back on track. So again, quantum biology is really important. Of course, I mentioned this already, talking about Sarah Buckley's work, Michelle O'Donnell's work, understanding physiologic birth and what really keeps birth safe. Again, I believe that we need obstetricians, we need cesarean sections at times, we need these life-saving interventions. But I also believe that understanding the physiology of birth and not messing with it unless it really truly needs to be messed with would lead to much better outcomes for mothers and babies. Not just life-saving outcomes, but also much better quality of life for mothers and babies. It's not just that at the end you deliver a live mother and a live baby, but ideally the experience is one, and because birth is a rite of passage for women. This is a massive transition for women. And so when we honor that and honor that transition, again, I did a YouTube video, a short recently on, when you don't have the birth that you want. And what I talked about was if you feel respected and heard throughout your pregnancy, throughout the birthing process, even if you need an intervention that you would rather not have had, you still feel more satisfied with that experience, and it's not as traumatic an experience for you. Even if you need to do some processing, you can still feel like fundamentally your voice was heard, you were honored and respected. And when we honor and respect the birthing process overall, it's much easier to be able to process that, because you may feel disappointed, but you don't necessarily feel violated the way that a woman feels when she's just put on this assembly line of interventions that may end up with devastating outcomes. She may end up with a healthy baby and a healthy mom, but the emotional health is just in shambles, or there's a long recovery time. I have so many moms come to me who are planning a VBAC, who it's just, their recovery, it was difficult. We know that women who have a cesarean are much less likely to have another baby because it's just a difficult experience on many levels. And so understanding physiologic birth, understanding your options, advocating for yourself, learning to speak up for yourself, all of that leads to a safer and better experience for you and your baby. And again, if you need somebody to walk through you or walk with you through all of this, if you need somebody who's going to help you with the research, help you with the advocacy and dialogue with your care provider, with your birth partner, with anybody, getting everybody on board who can help you really understand this, that's exactly what I do with my pregnancy coaching. So you can definitely reach out to me, and I'm happy to talk with you. And then also the final point that I have before we close this episode is I believe that we need social support that truly values motherhood. And I've talked a lot about this in the last several episodes where I dove into motherhood issues, but I feel like we're in a society that gives lip service to moms, buy mom a Mother's Day card on Mother's Day, but it kind of blows my mind. There just seems to be very little understanding. Like I'm involved in advocacy and that kind of work, but I'll have people come up and they'll say, "Oh, Kristen, you should do this, or you should help with this, or you should help with this," and I usually smile and I thank them that they think that I'm capable of that. But I also sometimes marvel at, I told a friend of mine that I wanted to video record 24 hours in Kristen's day, and when somebody asks me to add something else on, I want to just hand them that and say, "Hey, watch 24 hours in the life of Kristen and then figure out if Kristen can really take anything else on." I think there's just this lack of acknowledgement for the intensity of mothering and the disconnectedness of mothering now, where we're not really in community anymore while we're doing that. And so I think that what we really need is to rebuild social support systems that truly value motherhood, that don't value childcare. I mean, we need competent childcare for moms who choose to work. But again, this is another discussion that tends to distract. It's like when we're talking about the quality of childcare and affordable childcare, but we're not talking about what could we do to perhaps support mothers to be at home. And that's the reason why I feel like, for example, maternity leave policies do need to be talked about in the United States. But, overall, there's just not a lot of value for moms, and there's not a strong social support network. And I think as we continue to get more fragmented into this kind of disembodied online life, sometimes that falls through the crack even more. So if you can find moms groups in your area where you can connect with moms in person, I do think that online communities are good, and they've supported me throughout most of my pregnancies. But I would also encourage you to see what social supports there are in your community. And one of the things that I hope as my kids grow is that I can build more social supports in my community, because I remain disappointed by churches and community groups and those sorts of things and what they provide for mothers. And I think that social support services provided by the state are misguided, in that they often imply that what we need to do is get the kids in daycare and get mom working at a fast food restaurant. And so societally, this is a problem. We see not a lot of honoring of the time of pregnancy and early motherhood, when a mother should be mothered and be able to take it easy and nourish this little one. And we see little value. So I think that it's something that's important for you, because we can't create systemic change overnight, but it's important for you to look at what there is in your community, in your peer group, in your family, extended family, all those things. What kind of supports can you bring, and can you build for yourself, even if you're alone, so to speak? And I've been that way throughout much of my mothering years. What support systems can you put in place for yourself? And that might mean an online group. It might mean streamlining this, that, and the other, decluttering the house, those kinds of things. Again, those sort of practical steps are things that can be talked through with somebody. But I want you to think about those things, because putting those things in place or seeking out those supports can help you relax and really enjoy your pregnancy. So again, to sum this episode up, the reality is, yes, there are complications that can be life-threatening in pregnancy. We want to have medical care to handle those things. But the reality is not that pregnancy in and of itself is like some inherently dangerous condition of being. What we need to do is respect pregnancy, understand the physiology of pregnancy, understand the physiology of birth. We need to do research and have conversations on how do we make these things safer. We need to look at elephants and biases in the room, such as the focus on low-fat nutrition that has really robbed an entire generation plus of good health. We need to look at things like metabolic syndrome, insulin resistance, that are creating health crises all over, and ask, how are these things impacting pregnancy and birth? We need to be asking a lot more questions. We need to be a lot more curious. And we need to shift the discussion, especially for young women whose voices can be heard, is shift the discussion from pregnancy is horrible or life-threatening or motherhood is life-limiting to, okay, what can we do to make sure that the women who do want to be pregnant, who do want to have babies, are able to do that they understand fertility, that they understand pregnancy, that they understand birth, that their voices matter. And so policy is being shaped to look at, how do we have healthier pregnancies and births? And I do think that some of those conversations are happening. I participate in a regional perinatal collaborative in my area that is mostly people from like the standard obstetric system, public health agencies and things. And I do think that these people really do want to seek and ask, how can we improve maternal health? How can we improve infant health? So those questions are being asked, but I think sometimes there's so much else going on, like the clouding of the gender debate and taking women out of pregnancy and birth and all of that kind of stuff clouds. And then looking at biases, like feeling like we have to toe the government line about nutrition and that kind of thing. Those sorts of things are barriers. So it takes a lot of women being curious, asking questions, wanting to understand and grow to help change these things. So anyways, I don't want to go off too long, because I know I'm going to end up waxing poetic and philosophical and lose y'all if I haven't lost you already. But so with the next episode, we're going to kind of continue this conversation, but we're going to talk more directly about abortion in that episode, because I feel like it's just a required follow-up. So I will see you then. Again, if you need help personally, reach out to me. You can email me, Kristen Kristen at naturalbirthandbabycare.com. You can find me on Facebook, or you can just go to birthbabylife.com/beautiful and book a call, and I can probably talk with you in the next week. With that, have a blessed week and take care.